I get the question all the time, Dr. Lin, why treat nerves first? I started realizing that this is something that I started to do more and more at Rehab and Ride Physical Therapy. Treating nerves, the nerves itself, the entity is like a conduction, it's like a wire. And if it's shooting the messages correctly and conducting correctly to the muscles, the impulse at the right time for whatever you need, whatever activity that you need, then the muscles obviously are connected to the joints. And so if these are, let's say there's a pinch, or let's say there's a barrier for these nerves to go through, the conduction's slower. And I like to think of it as direct current and alternating current, where alternating current is on, off, on, off, on, off. At some point when it's off, that's when your chances of injury increase. When it's on, when it needs to be turned on right away, then that's that direct current where it goes, I need to flex my muscle, and you will as quickly as possible. We want to improve efficiency through movements, and that's also why we're treating nerves first. But more importantly, the nerves have a physical entity where there can be scar tissue and adhesions that bind down the nerves in between muscles, and also sometimes the nerves attach themselves to other vessels and or the bone. And so you can see how all this can really affect things in a biomechanical way. So that's why we have at Rehab and Revive decided to call this neuromechanical therapy. We want to treat the nerves and how it affects our mechanics. And in this way, it has created worldly success. People all over the world have come and seen us, as well as, it's gotten quicker changes, much quicker. I would say 30 to 40% quicker than your traditional physical therapy, where they're just trying to go after the muscles, and indirectly maybe they're going after the nerves. So maybe that's why things are helping. But if we can increase that velocity itself is really important, because if you think at force, the equation for force is F equals mv squared. So the v squared, if we can improve it or enhance it by 0.01 or 0.1 squared, you can imagine how much more force we can produce, and therefore safety goes up, and then efficiency goes up, and in the end we have a better, more fluid, more optimal movement. Yeah, so this is an unwinding that happens with the neuromechanical therapy, NMT, and a lot of times they think I'm just supporting the weight, but if I just kind of let go, you can see that, she's kind of doing that on her own, and I only have like one finger. But this is someone that has like your classic, what would be called adhesive capsulitis, but it kind of does. I'm just following it, so it's always neat to watch when we do the limbs of NMT, how we can free that up, and we just help guide. That's all we're doing, and then it slows down, and then all that tension that's built up usually starts like evaporating, and we want that, and it gets in some weird positions sometimes. I've got myself in some weird positions before, but I'm just helping it, but I'm not doing this, and it's a very unconscious, subconscious thing, and we gotta listen to our bodies, and this is starting to loosen up a lot more, right? Yeah. Yeah, good. Yeah, good. And slowing down, which is good. It usually goes fast and then it slows down. So the next question is, what is it that's so important about these nerves? I kind of expressed why nerves first, but now you can see quickly on these charts, on these anatomical charts, that nerves course itself through everywhere, and they not only go from the back, they're also in the front. And this is what this autonomic nervous system is really important for me here. As you can see, most people care about the nerves in the back, and although they're important, you need to understand that the nerves in the front, there's way more. And what we're looking for, our strategy here at Rehab Revive, is to work on these nerves to free them up. I basically call it nerve real estate. We want nerve length. And the more nerve length we can get, imagine you being able to get as far reaching up here and curl up into a ball. We basically make 40 to 50% changes in between. So we're basically doubling our size, and imagine if something gets caught. And a lot of times the symptoms that present are numbness and tingling, pain, sometimes paralysis, numbness, and we'll talk about that in a little bit, but you can see that all these things affect. So when we can get to the root of things by working on these nerves in the front and getting things more mobile through neuromechanical therapy, then what we're gonna do is we're gonna get you more movement. You can see how that affects range and gives us length. If we have length, imagine a shirt that's tight, and if this is tight, you bet I can't move that very far. But if I release that everywhere, I have now more mobility and being able to be more flexible. All right, we're back. Another neuromechanical therapy moment. Right now, we're getting our gal's shoulder blade to, I'm not moving it, so, and she's not moving it either. So it's just the nerves trying to unwind. I think there's something to it. Oh, that was just taking me down. Okay. Does that feel unusual to you? Does it feel like I'm controlling it?
Yes,
or?
it is.
Oh really? Weird, maybe.
It's not?
No. It's like doing its own thing. So this is what I call unwinding. And you know, I mean I can't move it with two fingers, right? I'm just holding the 2 points of the nerves to release it. I'm just following it and allowing, or giving permission for this to release. So it's an interesting thing when we see this. The nerves are talking now. So now, these explanations have led us to what I have called the neuromechanical system. You've heard about this neuromechanical therapy, but what is the neuromechanical system? And what I like to think of it as this giant net. And if you're a fisherman or you fish, then you understand nets. Most people traditionally think of the nerves as just lines. And you can move them, or you can do things like glides. And what happens here is that I think the net is like a tube or a funnel. And if something gets twisted at the upper end, you can imagine something happening like a car accident. If you get twisted or whiplash, something goes all the way down. So it can affect your arm, it can affect your legs, and that's what makes it a little bit interesting. I liken this to when you scratch your ear, you might feel it in your forearm, or when you scratch your leg, you feel it on this side. And we've all experienced that, and you find it, hey, that's a weird pain, and you tell someone about it, or I feel the line that goes all the way from the back of my head, all the way down to my ankle. That's the neuromechanical system. It's a giant net, or a web is what some of my patients have decided to call it. It's a web where we work on one thing, and it fully starts changing the whole integrity of the length and the tension and the strength and the way things fire. That's the neuromechanical system, and that's why it's important that we now have defined it, and we're going to talk about nerves a little bit more next. So what we have right here is the nerve pain behavior scale, and we've created here at the clinic because this is something not only myself I've had to deal with, but 99% of our patients' population goes through this behavior. You can go from the healthy nerve and move down the degenerative cascade and move all the way down to paralysis. And what we mean by paralysis is a motor deficit that creates something like a drop foot, or having knee buckling, or unable to open a jar, or dropping the key every time you try to put the key into the lock. And so what we want to do here is see how this progresses and or digresses. So the degenerative process moves from healthy to something that's more pressure sensitive, stiff, or fatigue. And those are things that like light up some people. And then we move to a temperature issue where it's hot and cold sometimes, and it just feels cold all the time, or always feels hot and inflamed. Then it moves towards pain. Pain's typically the lightning bolts, or the constant pain, the ache that just keeps going down your whole leg. Then the next thing is tingling, and numbness kind of run together. But when it goes to more numb, that's when you're more at the very moderate severe end. And then severe end is when you've got that paralysis or motor drop. And then we want to move it backwards. As you get better with neuromechanical therapy and our techniques here, we're trying to move you all the way up the scale back towards healthy. And some of you don't realize that as you get healthier, the tingling stops, the numbness stops, but you just feel pain. That's a good sign, is usually what I tell our patients here. And so we want to move to pain, because then eventually the next stage is that temperature changes, and then the stiffness or fatigue, and then back to healthy. So we can reverse that here with our neuromechanical techniques. It's not as erratic as you think, and it may drive people crazy, but what we're trying to do here is scale it out and show people that, hey, you are getting better. Work on these nerves, and then get the nerves to conduct the right way, to improve mechanics, improve our function, improve our life. Or, you know what, you're getting worse, and you need to come right in and get this neuromechanical system checked out and worked on. Yeah, so we're just trying to kind of push things through to the, and let relax, but it looks interesting. It's a very interesting thing, but it's unwinding, you know, and that's what it is. It doesn't have a rhyme or reason or method, and really needs to unwind and just whatever. Sometimes when you're in pain, we're always trying to find a position. I think that's what it is. And it just harbors the memories because it just keeps getting stuck. So, alright, you doing okay? You still there? Mm-hmm. Yeah, so it's not like it shouldn't be painful, but it looks painful.
No, it's not painful at all.
Yeah.
It actually just feels like stress moving away from the nerves.
Yeah, the nervous system. So how can neuromechanical therapy or NMT help you? And what does it mean to you or me? The neuromechanical system and the theory